Today we are going to be reviewing order entry. For the purpose of the demonstration today, I will be logged in as an inpatient nurse. As reviewed in previous demonstrations, when logging in as an inpatient nurse, it will bring me directly to this Care Compass page, otherwise referred to as the landing page. It is here where I'm able to easily access the patient's chart. As reviewed in previous demonstrations, it is important to establish a relationship with a patient prior to entering their chart. As you can see, I have already established a relationship with Beyonce, and that is why additional data is populated beside her name. Given I am part of the circle of care and should be privy to patient-sensitive information, I will enter the patient's chart by selecting this blue hyperlink. Once within the patient's chart, we will see additional tabs listed across the top. These are referred to as Millennium pages, or also known as M pages. Within each M page, there are different components listed. These components are customizable by simply dragging and dropping. For the purpose of the demonstration today, we will focus on the orders component. As you can see over on the right-hand side, I am able to view all past and present orders for this patient's current encounter. I am able to see the order name, details, the start date, status update, as well as the ordering provider. I am also able to modify the view. Currently, I have it set at viewing all active orders. By selecting this drop-down arrow, I am able to customize that view. While I am able to view all past and present orders for this patient's current encounter via the handoff M page, I am not able to add an order from here. In order to add an order, I would go over to the left-hand side to the blue menu bar and select orders. Keeping in mind this is computerized provider order entry, it typically should be the provider entering the order unless it meets circumstances according to policy. I will select orders. Here I am able to see under view different categories of orders that could be inputted. On the right-hand side, it will display the order name, status, dose, and details. If it is an appropriate scenario, I will select Add Order. From here, I am able to search the order. For example, CBC. When I type in CBC, it will bring up some options. If I select Enter, it will bring up a much more comprehensive list. For the purpose of the demonstration today, I will select CBC with diff. The yellow fields shown here are mandatory fields. I am not able to sign this order off without completing those mandatory fields. I will enter in the physician's name. The order date and time will be the current date and time for this particular scenario. And then I would enter in the communication type, which has been reviewed in previous demonstrations. For the purpose of this demonstration, I will select verbal with readback, which basically means I'm taking a verbal order from the provider. And at the time that I am taking this order, I am reading the order back to the provider to ensure accuracy. And I will select OK. This will then bring me to what is referred to as the scratch pad. And this is where I am able to collect additional information. Again, the yellow fields are mandatory fields. So specimen type will be blood. The collection priority, I'm going to enter as stat because that is what the provider told me when I accepted the verbal order. And then I will scroll through. Collection date and time is the current date and time. I'm going to complete this once. I'm going to select nurse to collect this sample. And I'm going to select no to order for future visit. I am then able to sign this off. I am receiving a prompt indicating that this is a duplicate order alert. This is because we are working off of a test patient where the same order has been inputted previously. I will therefore select OK. When I refresh my screen, we will then be able to see that the most recent order, again, there are additional orders in here given this is a test patient, but the most recent order just inputted is a CBC with diff. The status is ordered and has been dispatched, and there are additional details here. If I needed to modify this order, if I right-click on the order, it will bring up options to modify, cancel and reorder, cancel and discontinue. Perhaps I need to void it. I can also select other information, and it will bring up some additional details all in one pane. When I go back to Care Compass, which is my landing page, again, I need to refresh my screen. Once I do so, for this particular patient, I will see under activities that there is a new order. And we will see at 10:11, which is the most recent order inputted. Again, keep in mind, this is a test patient. There is a stat order. When I hover to discover, it shows there's an urgent activity, CBC with diff, that needs to be completed. Once I have signed off the verbal order that I have inputted, I am able to follow through on collecting that stat CBC sample. As I am doing that, the order that I have inputted into the system will flow across over to the provider's message center. It is there where they are able to accept, reject, or refuse the verbal order that I have inputted in the system. So long as everything is accurate, the provider will accept that order. And that brings us to the conclusion of the order entry microsimulation.